Rae-Lynn Bidon is a seasoned healthcare revenue cycle leader with over 15 years of experience spanning organizations such as Multicare Health System, Immediate Clinic, and Olympia Orthopedic Associates. She joined Secours Mercy Health as a consultant before quickly advancing to her current role as revenue cycle director for the urgent care and occupational health divisions. In this capacity, she oversees revenue cycle operations for the Virginia and South Carolina urgent care markets. Welcome to DX the podcast, Rae-Lynn.
Thank you. Thanks for having me.
So glad to have you here. So we're here in the AI house. This is the heart of your hometown. Feels like the future is just kind of happening all around us when you're in a place like the AI house, right?
Oh, it is.
Yes. So I'm thrilled to have you here. We're going to talk about a topic that doesn't always get the spotlight. So this is the chance, right? Urgent care cash flow and revenue cycle. AI is going to be a big part of our conversation today. It's changing the space so rapidly. But first, I want to start with a great point that you've actually made about how important it is for a patient to only have to explain what's going on once when they come into urgent care. So can you tell me more about this concept and why you see it as such a key part of urgent care success?
I think that's the beauty of urgent care, because when that patient presents themselves, they're not at their best, right? They want treatment. They want it fast. They really are not there to talk to a bunch of people. And that's the beauty about urgent care, is they come in and they present their issue that they're there for today.
Yeah.
And where that gets put into the system and the people that they have to talk to, it's in one spot.
Yeah.
And it's all about that visit and what they're here for today. And so they say it one time, and there's only a few people that they're going to see that day.
Yeah.
And so they really don't need to say it again. They may get asked additional questions about more detail about it, but everybody has access to that information and what they came in for today, and not other information.
Yeah.
It's really irrelevant to why they're there. So great patient service makes it more efficient for everybody. There's no confusion, and it just makes the visit that much faster. That's why urgent care is so ideal
Yeah,
for
it's somewhat unique,
so many
right?
people.
I mean,
Absolutely.
It's a unique aspect of healthcare where it's very much, here's what I'm here for, let's take care of this and let's move on.
Absolutely.
Very kind of retail focused. The experience for the patient is very specific, and it's what they're expecting, right?
It's what they want.
Yeah.
Yes.
They're not coming in to kind of hash it out for X number of minutes. They want to tell you what's going on and move on to figure out what needs to happen next.
Yep. They don't want to talk about their medical history. They don't want to talk about what happened last year.
Yeah.
Yes. This is what I need, and I need it today, and I need it fast.
Yeah, very unique and specific to urgent care. And so from kind of the financial side of things then, that is a very important kind of distinction for urgent care, is like, let's get to the point and let's get it figured out and let's move on. And you kind of have a unique perspective. You're at a larger health system, and urgent care kind of sits somewhat uniquely separate from that. So let's talk about some of the operational and kind of billing nuances in that setting. How can hospitals kind of adjust their strategies to make sure that urgent care is a true profit center when they're kind of embedded in these larger health systems that can kind of get bogged down by all the minutia?
Yeah, it's a great point. And I think one of the best things that that urgent care offers that healthcare system is freeing up their ER space. And so a lot of times a patient can be seen in the urgent care, and they go to the emergency room because they don't know any different. And so by going to that urgent care, they get seen faster.
Yeah.
They get right to the point, to what we were just talking about. But it's also a lot less expensive for the patient. And they're really truly only paying for the services that they need. But it's also a step into the healthcare system.
Yeah.
So it puts their footprint into that healthcare system. So if they do get seen at the hospital at a future date, or by a primary care that's within that system, then they have their information.
Right.
And they can share that, and they don't have to go through that whole registration process again,
yeah.
right? But at the same time, it's just a more efficient process to not have to do all of the extras that a hospital system would do.
Yeah.
And so it's just more efficient for both the patient and for the hospital system, but it's getting your foot in the door.
Yeah.
And it's getting people comfortable with that hospital system in a really nice, relaxed environment in that urgent care.
Yeah.
If it turns out they do need to go to the ED, that's always an option. They can be referred there. But just walking in the door of an urgent care is much less intimidating than an emergency room, and it just fits for everybody.
Yeah, a
It's
much
much
less
better.
much less chaotic,
Hmm.
scary, difficult,
Yeah.
right? All the things.
Yes.
And so that uniqueness about urgent care, it actually is kind of set apart from like a billing and RCM perspective at times, right? So tell me more about that.
Absolutely. So when you walk into an urgent care, you don't need a referral. You don't
Mm,
need a referral from your primary care. You don't need an authorization. There's you can be seen that day,
yeah.
and it's not going to be an issue.
Yeah.
You can have absolutely go online and put your spot in line,
Yeah.
and get seen, when you're going to be seen,
Yeah.
but you don't have to wait weeks on end
Mm,
for that. But it's also the one wonderful thing about urgent care is it's very low acuity. And what I mean by that is it's your common colds, it's
mhm.
strep throat,
Mhm.
it's things that don't require a lot of procedures
Mhm.
and a lot of invasive stuff. And
Mhm.
so it's easy for the payers, it's easy for the providers, it's
Mhm.
easy for the patient to explain
If
to
done
talk
right,
to.
right? Like it's
Yes, if
yes,
done
if you've got
right.
the structures in
But
place. Yeah.
yes, as long as you speak the language,
Yeah.
right? So it's just from a billing perspective, if everything is done right
Yeah.
from when that patient presents themselves at the front desk,
Success is on the horizon.
that's the
Yeah.
most critical piece right there.
Yeah.
Then it's easy. It's easy
Mhm.
all the way through, and there's no hidden surprises.
Yeah.
And I think that's really appreciated by the patient,
Yeah.
definitely appreciated by the healthcare system to not have a
Mhm.
surprise.
Mhm.
And the payers appreciate it
Right.
because if it's done right, then the reimbursement and the revenue cycle
Yeah.
is complete
Yeah.
without touching it.
Right.
It's
All
all
that
that
manual
AI,
work that you
right?
don't have to worry about and
Yes.
extra hands on the claim, for
Everything is
example.
automatic
Yeah.
as long as it's done right from those initial steps.
That's
So,
great. Yeah.
yeah.
I mean, it's kind of that 80-20 rule we talk about oftentimes in urgent care. 80% of the time, it's going to be the typical kind of the bread and butter. There's going to be the 20% outliers, but if you can narrow in on that 80% and make sure those systems and processes are in place, you have a road to success from an
Oh,
RCM
100%,
perspective. Yeah,
100%. And
for
it's not a
sure.
complicated formula to get
Yeah.
that 80%
Yeah,
done. Yeah.
exactly. So another thing we've kind of talked about is that, in the urgent care space, sometimes reimbursement versus expenses is not something that people think about or is at the forefront of their thought process. So not always cross compared. Without that dedicated attention to detail, there could be some major misses there. So, what are some practical strategies for how urgent cares can kind of optimize their financial performance as we think about this comparison of reimbursement and expenses in the urgent care space,
Oh,
especially?
it's something you always need to stay on top of. I'll give you a good example. So your lab testing and your molecular testing, urgent cares have so many tests that they can do in the clinic
Hmm.
now and give the patient their immediate results. What a fabulous bonus for the
Hmm.
patient, right? But if you don't pay attention to what you're paying for
Yeah,
that test and what you're getting reimbursed
right.
for that test, you actually may be doing it at a loss.
Hmm.
And so I recommend that the lab works that you provide
Hmm.
in house, all you got to do is get your expense
Yeah.
per dose and take your 5 payers. What are they reimbursing for that
So you don't
unit?
have to do all of
You don't
them.
have to do
Yeah.
all of them. Do
Yeah.
your top 5 payers,
Yeah. That's
and
great.
most
Yeah.
of them will follow a guideline. And
Hmm.
so you know who your top payers are, you know your contracts, and
Hmm.
you don't need to do it every month,
Yeah.
once a year, once every 6 months
Sure.
is more than sufficient. But you definitely have to look at it because one year it might be very cost effective and you have a nice profit.
Things
And the next
change.
year it might not even be covered.
Wow.
That's what happened
Yeah.
with COVID. Your
Hmm.
COVID testing was covered. It's no longer covered, and so you
Yeah.
just have to stay on top of, is it a covered service? And if it is, what am I paying for it?
Yeah.
And what am I getting paid
Yeah.
for it?
So very practical approach. Almost kind of make it a methodical piece of like your workflow,
Absolutely.
essentially. Make sure it's baked into what you're doing at least yearly, if not a little bit more often, and ensure that kind of
Absolutely,
comparison.
yeah. I
That's
mean, it
great.
doesn't take a lot of time.
Yeah.
It's easy.
If you had to pick your top 3 tips to drive revenue and make sure that urgent care gets properly reimbursed, especially when we think about millennials, Gen Z, this kind of more nomadic, on the move cultural population, what would the couple things be? Couple 3 things maybe that you would recommend?
They're the easy ones,
Okay.
but it's almost like the basics will
Yeah.
get you where you need to be. So, collecting the insurance information at the time of service,
Hmm.
but not only collecting it, verifying it. So, make
Hmm.
sure you take that extra step to verify that they're eligible and then collect their copay. It's a retail service.
Yeah.
So, I think the connotation of asking patients for money used to be a really no-no, taboo
Right.
subject. But urgent care, it's a retail service. Asking for that copay at the time of service,
Mhm.
absolutely expected by the patients to have to pay that at the time of service.
Yeah.
And then the gold nugget, if you will, is to get them to put their card on file in case
Ah,
there is an expense after. And I think the big motivation is when you ask for that card on file and tell them, there'll be a $250 max
right.
that we would charge. Put some kind of
Transparency
talk to
around
that.
it. Yeah.
Yes. So they're not just saying you can charge my account whatever you want.
Yeah.
I think there's a lot of resistance to that. And that's the beauty about urgent care. An emergency room wouldn't be able to give you a cap,
Right.
right?
Right.
Not even your provider's office. But at
Right.
urgent care, we can absolutely say maximum 250, but if you just put your card on file,
Yeah.
and then they can walk out the door and you will get paid for that visit.
Yeah.
So it's a really nice
I like that approach
way.
with the transparency, especially because we don't always get transparency in healthcare in a lot of ways. So
Yeah.
it's time to change that narrative,
It's
right?
nice. It's nice to be able to have that.
Yes. In the retail perspective as well, that's the experience that they're looking for. That's what they've come to expect. And then to be able to actually deliver on that is super helpful. So,
Absolutely.
well, this was great. Thank you, Rae-Lynn, for all of your expertise and insight and knowledge that you bring. I really appreciated you being here on DX. And until next time.
Thank you. Thanks for having me.
Yep. DX the podcast was born out of the idea that we are ready to diagnose the future of urgent care with the smartest leaders in the industry. Find all the other episodes on Spotify and LinkedIn to keep up with us on the journey.